Hello everyone, this will be a video about contraceptives. I will be speaking about what contraceptives are, what they are used for, their potential side effects, and I will also discuss ways to tell if you are pregnant and ways to figure out if you are not pregnant. I hope you find this helpful, and please see the description for some additional resources. So what are contraceptives? Contraceptives are methods of family planning that prevent pregnancy. They come in the form of pills, implantable IUDs, and barrier methods, but they can also come in the form of an emergency morning after pill that helps to prevent pregnancy after intercourse, usually a one-time dose. Let's discuss the categories of contraceptives in more detail. The first category are IUDs, or implantable uterine devices. Like the name suggests, these small contraceptives are inserted into a person's uterus to act as both a barrier and a hormonal deterrent against pregnancy. There are copper IUDs, IUDs that contain no hormones, and even implantable devices like Nexplanon that are inserted into the skin of the arm. A copper IUD can be started anytime and needs no backup method to accompany it. Before insertion, a gynecologist will perform a bimanual examination and cervical inspection to make sure the area of implantation is adequate. The LNG IUD, or levonorgestrel IUD, contains a hormone that prevents heavy bleeding as well as pregnancy, which is why some people may opt to use it for menorrhagia or very heavy periods to regulate their flow. This IUD can be started anytime. If the person has menstruated more than 7 days ago, it is recommended to use a barrier method of contraception, like a condom, for a week to ensure no accidental pregnancies occur as hormone levels begin to change. Like the copper IUD, a bimanual examination and cervical inspection is required. An implant can be inserted anytime. If more than 5 days have passed since menstruation, it's best to use a barrier method or abstinence for 7 days. No exam is needed before starting an implant. DMPA, or depot medroxyprogesterone acetate, and try saying that 3 times fast because I know I couldn't, also known as Depo-Provera or the Depo shot, is a hormonal contraceptive that is given every 12 weeks or 3 months for a total of 4 shots a year. This method can be started anytime. If more than 7 days have passed since menstruation started, use protection for 7 days. No exam is needed prior to beginning Depo. CHC, or combined hormonal contraceptives, are combination pills, patches, and vaginal rings that contain estrogen and progestin in various formulations. They can be started anytime. If more than 5 days have passed since starting your period, use protection. Blood pressure measurements and monitoring is necessary before and during the duration of use for CHCs, as they can increase blood pressure as a side effect. Norethindrone, norgestrel, and drospirenone, also known as POP, or progestin-only pills, also known as the mini pills, are pretty self-explanatory. They're contraceptives that only contain the hormone progestin and no estrogen. They can be started anytime. If menstruation started more than 5 days ago, use protection for 2 days. No exam is needed before starting progestin-only pills. The only difference between the 3 is that dronespirenone, also known as Yaz, should be used with the barrier method for 7 days instead of 2, if menstruation has occurred more than 1 day ago. Now, how can you tell if you are pregnant? Here are some common presumptive signs of pregnancy: bloating, going to the bathroom often, breast soreness, fatigue, a missed or late period, and nausea. Probable signs include a positive pregnancy test and some signs like quickening. And positive signs include fetal heartbeat on ultrasound, visualization of the fetus, and palpation of the fetus in the uterus by an examiner. Some signs that you may not be pregnant include: if it is less than 7 days from the start of your menses, you have not had intercourse since the start of your last normal cycle, You have been correctly using a reliable method of birth control every day. You are less than 7 days from a spontaneous or induced termination of pregnancy. You are 4 weeks postpartum or less. Or you are fully breastfeeding, have not resumed your menses, and are less than 6 months postpartum. If you think you may be pregnant but still want to consider future family planning, Depo, an implant, combined hormone contraceptive, and progestin-only pills are likely safe and exceed any risks. In 2 to 4 weeks, a pregnancy test will be given, and your doctor should reevaluate you. An IUD should not be placed unless the provider can confirm or rule out pregnancy, as placing an IUD when already pregnant can lead to an ectopic pregnancy. For persons with HIV or persons who are high risk of acquiring HIV who would like to consider contraceptives, a WHO brief from 2019 changed all contraceptives to MEC Category 1, indicating there is no restriction for use. This means any of the above-mentioned methods are approved. The trial, which included a large sample size from areas where HIV is endemic in Africa. All methods were deemed safe and effective, and no differences were shown in risk of effectiveness among the sample of women tested with Depo, copper IUDs, or levonorgestrel IUDs. Similar results showed no decrease in effectiveness for CHC or implants in women at high risk of acquiring HIV. A woman's risk of HIV should not affect her contraceptive use. That being said, HIV testing should be integrated into family planning. STI prevention services should be encouraged in these settings. In addition, for any group of persons trying to prevent pregnancy, partners should consider wearing a condom, which also protects against many STIs. While contraceptives prevent pregnancy, they don't protect against any STIs. For those at high risk of acquiring HIV, PrEP, also known as pre-exposure prophylaxis, is indicated, and this can be obtained from your PCP or community health clinic at little to no cost to you. If you have a Ryan White HIV clinic near you or Planned Parenthood, they can provide PrEP as well as PEP, which is post-exposure prophylaxis. Protecting against HIV also protects your unborn child if you do decide to conceive. For people who want a method of family planning that uses no hormones, pills, or injections, consider using the standard days method. When using this method, don't have intercourse on days 8 to 19 of your cycle when you are the most fertile. In order to use this method, you must have a regular cycle that can be easily mapped out, with periods lasting 26 to 32 days. This method is reversible and can begin at any time. If you choose to use this method, consider also using a male or female condom to prevent STI transmission. In addition, PrEP can be used by those at an increased risk of HIV and their partners. If a person is intimate on days 8 to 19, they may need emergency contraception, so please make sure to stock up on these. They are available over the counter at all pharmacies with no age restriction. If you have a cycle of less than 26 days or more than 32 days 2 or more times a year, then you should consider using another method, as SDM might not be reliable enough for your needs. So, what should you do if you take your contraceptive late or miss it entirely? Well, it depends. If a pill is late, which means it's been less than 24 hours since it should have been taken, you should take the late or missed pill as soon as possible. Continue taking your regularly scheduled dose, even if you end up taking 2 in one day. You don't need any other protection. However, you might want to consider an emergency contraceptive if you were late and or missed a pill during the beginning or end of your cycle. But in most cases, you don't need any. If 2 or more pills have been missed over 48 hours, or if they were late, take the most recent pill as soon as possible and discard all the other pills. Continue taking the remaining pills as scheduled. Don't have intercourse until you have used your contraceptive for 7 days on time. Or if you do, use a condom to prevent the risk of pregnancy. If pills were missed in the last week of hormone pills, for example, days 15 to 21 for a 28-day pill pack, omit the hormone-free interval by finishing the hormonal pills in the current pack and starting a new pack the next day. If unable to start a new pack immediately, abstain from sexual intercourse or use barrier methods like a condom until hormone pills from a new pack have been taken for 7 consecutive days. Emergency contraception should be considered if hormone pills were missed during the first week and unprotected intercourse occurred during the previous 5 days. To switch gears a bit, we've thus far talked about reversible methods of contraception. What are permanent methods, or at the very least, methods that require surgery to reverse? Tubal ligation and vasectomies are 2 of the most common methods for permanent contraception. Both of these methods ensure almost guaranteed contraception prevention and are among the least likely to fail. These methods are usually considered after other family planning methods are either deemed unwanted because of a more permanent solution, or used by couples who don't want any more children and want a method that ensures they can continue intimacy. Note that neither of these methods protect against STIs. In regards to vasectomies, those who choose to get it should ensure that they don't have intercourse for a week to heal the site. Some viable sperm can still exist after the surgery, so a waiting period is necessary. Finally, I want to discuss emergency contraceptive options. Contraceptives don't always work with 100% accuracy, and everyone is human and may forget to take a pill on occasion. There are 2 options for emergency contraception. There is the copper IUD, and there are 3 ECP, also known as, obviously, emergency contraception pills. These pills are the combined estrogen and progestin pill, ulipristal acetate or UPA, and levonorgestrel in 1 or 2 doses. In both cases, these methods need to be used within 5 days of unprotected intercourse. As I said earlier, all ECP should be available at your local pharmacy without a prescription or need to show ID, but the prices can be pretty steep, so plan accordingly. In closing, I want to mention a quick list of side effects that are common with contraceptives. These side effects can include nausea, headache, breast tenderness, changes in menstrual flow and timing, mood changes, weight gain, and breakthrough bleeding when starting or stopping the contraceptive. And finally, a very important warning. For those people who smoke, are overweight, and/or are 35 years or older, do not use any contraceptives containing estrogen, as this can increase your risk of a blood clot. And on that note, I would like to thank you all for listening and watching. I hope you learned something. Please leave any questions in the comment and I will do my best to answer them. However, I also advise you to ask your doctor. Remember, you and your care team know your body best. All resources will be included in the description. Take care, everyone, and have a good day.